There are methods that the experts suggested to prevent unplanned pregnancies and also to decrease the level of early pregnancies. Here are some examples of methods. First, we have the condom. Condom, it is a rubber sheet that fits over the penis. How it used? Of course, it will insert that and rolled over the penis, but make sure that there is no hole on it. Condoms, when used correctly, are safe and highly effective in preventing transmission of sexually transmitted infections such as HIV and unplanned pregnancies. But take note not to use condoms with oil-based lubricants such as creams and lotions. Isn't it effective? Yes, of course. It is 80 to 85% effective. And for the benefits, it is low cost and easily accessible because it is available in the boutiques or in the Mercury drugs nationwide. Second, we have the implantable hormone device, or often called the birth control implant. It is a small plastic tube that doctors put under the skin of the upper arm here. The tube releases hormones that can protect against pregnancies for up to 3 years. The advantage of using implant as a birth control is that it is less hassle because the effectiveness will last up to 3 to 5 years. Third, we have the calendar methods. This kind of birth control involves tracking your menstrual cycle on the calendar to predict ovulation. You use this information to identify when you are most fertile. When you're fertile, you avoid sexual activity or use other types of contraceptives such as condoms. How to use calendar methods? Count the days in your menstrual cycle starting with the first day of your period as the day 1. On days 1 to 7, you are considered not fertile and you may have unprotected sex, although you may have menstrual bleedings on those days. On days 8 to 19, you are considered to be fertile and you should use contraceptives during intercourse to prevent pregnancies. Isn't it effective? Theoretically, it is 85% effective, but in reality, it is 60% effective. Fourth, we have sterilization. We have vasectomy for males and tubal ligation for females. Tubal ligation is a type of permanent birth control. During the surgery, the fallopian tubes are mostly cut or tied to prevent pregnancies for the rest of your life. Next, we have the vasectomy. It is a form of male birth control that cuts the supply of sperm to your semen. It's done by cutting and sealing the tubes that carry sperms. For the effectiveness, theoretically it is 100%, but exceptions have been known to take place. For the benefits, it is highly effective, permanent, and one-time expense. Fifth, we have the birth control pills. The birth control pills contains hormones that the women take every day to prevent pregnancies. Pills keep you from ovulating. This means that the pills keep your ovaries from releasing eggs. How to use birth control pills? One pill must be taken daily after the menstrual cycle, or you can take a pill as long as you are not pregnant. For the benefits, it is low cost and easily accessible because it is available to the drugstores nationwide. Sixth, we have the injection birth control. Depo-Provera is a well-known brand for the medeoxyprogesterone acetate. It is the contraceptive injection that contains the hormone progestin. Depo-Provera is an injection given for every 2 to 3 months. Depo-Provera typically suppresses ovulation, keeping your ovaries from releasing an egg. Depo-Provera is given by the doctor. Seventh, we have withdrawal. Withdrawal, it is the removal of the penis from the vagina before ejaculation. During intercourse with your partner, when the man reach to the climax, they must remove their penis away from the vagina and releases their sperm. By doing that, pregnancy will be prevented. Is it not effective? Theoretically, it is 85% effective, but in reality, it is just 70% effective. Last, we have intrauterine device or IUD. IUD, it is a small plastic T-shaped device used for birth control. It is inserted to the uterus where it stays to prevent pregnancies. How does IUD prevent pregnancies? IUD prevent pregnancies by blocking or not allowing the sperm to fertilize the egg. It may also make it harder for the fertilized egg to implant in the uterus. Is it not effective? Theoretically, it is 95 to 98% effective. How to use IUD? IUD, it was inserted by the doctor during the first few days of menstruation. And it should be examined and monitored every few months. There are many ways or methods to prevent pregnancies. But as a student, we must not involve in any sexual activity to prevent teenage pregnancy. We, as the student, should wear the essence of self-control for us to have a better future.